So another inflammatory-based condition is psoriasis. So psoriasis is a genetic disorder, and usually does begin during childhood. It could potentially be precipitated by a bacterial infection. So it's an inflammatory process that basically causes rapid growth of the epidermis. It's a T-cell mediated disorder, so it causes the epidermis to grow, and that kind of dictates the type of lesions that are present. So usually with psoriasis, what you commonly see are these big plaques that essentially form on the extensor surfaces of the body. So the extensor surfaces of the body are, like, for instance, the back of the elbows, the front of the knees, are common areas where you have this. You could also see it sometimes even on, it can cause issues with the fingernails and toenails as well. So again, look at the treatment options for this condition and include that on your chart as well. Impetigo is a bacterial infection, so it's either caused by a staph or strep bacteria, very common in warm, moist areas, and this is contagious. It can be transmitted via direct contact, and individuals with open wounds are particularly susceptible to getting impetigo. So very important to make sure that your wound care is very good if athletes do have open wounds, to cover that, because that could predispose them to skin conditions as well. Acne vulgaris is an inflammation of the sebaceous glands and hair follicles. So when somebody has really bad acne, basically the way they do is they classify it by the amount and the type of lesions that they have, because you can potentially have different types of lesions with acne vulgaris. So we have up here the different types of lesions and how they get classified. It also kind of breaks down based upon whether it is non-inflammatory or inflammatory acne vulgaris. So you can have sometimes different lesions depending. So usually non-inflammatory usually includes cases where people get what they call blackheads or pimples, and with inflammatory type they usually involve cystonodules. Folliculitis is a staph infection of the hair follicles. So one of the ways to just pick this out pretty easily is if you look at the skin, just look at the base of the hairs and see if right at the base of the hair you have your particular lesions related to this. Common causes of this are either just basically friction, or it's possible that it could be in hot tubs. Sometimes the bacteria that causes this can be present in there, and people can have outbreaks of folliculitis with this. And basically the treatment, which you'll include again in your chart as always, will be based on whether it's systemic, so meaning if it's more present throughout the body, or whether someone just has a very small, very localized area of folliculitis. Furuncles and carbuncles, these are basically boils. They're produced by staph bacteria. Furuncles are basically little individual boils. Carbuncles are when you basically get a collection of boils to form together. Again, sites of friction are very common areas where you will see this. Many times they start out as a nodule lesion and progress to a pustule, and in many cases a very large pustule. And again, the only real difference between the two is the size. So the size, obviously furuncles are smaller, carbuncles, because they're basically a grouping, are much larger. MRSA, or methicillin-resistant Staphylococcus aureus. So again, another bacteria infection. What makes MRSA so difficult to treat is that it is resistant to many types of common antibiotics. So they're resistant to beta-lactam and cephalosporin antibiotics. This basically the reason why MRSA bacteria forms is pretty much because of bacteria overuse, or antibiotic overuse. And so what happens is the bacteria basically accommodate to the antibiotics, and then they become resistant to it. So it's spread via direct contact. You have community or hospital-based. At one time it was very rare to have community-acquired MRSA. Many times this was only ever really seen in hospitals, just because of the nature of obviously sick people being in the hospital and a lot of antibiotic use. But again, as more and more people use antibiotics to treat things that they shouldn't be treating them for, that's where this has come about, where it's much more common to see community-based. You see the risk factors up on the screen. Again, close skin-to-skin contact, contaminated items, crowding, cleanliness, which is we're looking at poor hygiene and compromised skin. So they refer to this as the risk factors being the 5 C's of being at risk for acquiring MRSA. And what you'll typically see with this is it will eventually progress to systemic symptoms. So you look for any lesion that's really starting to grow, or other systemic symptoms to start to develop to differentiate whether you're dealing with MRSA. So because of the nature of this condition, the NATA actually put out a position statement on it. So just basically covering some of the basics as far as prevention. So again, hygiene being a big thing. Open wound treatment, making sure that all open wounds are cleaned and dressed appropriately. Facility cleanliness. Any individuals that don't have lesions that don't clear, because again, sometimes this could look very like just a simple little small lesion at first that you think is maybe just even a basic pimple, and eventually it grows out, and then you end up having more systemic problems later on. So cultures if necessary, and just make sure that all lesions are covered to prevent spread to other individuals.